All right, joining me now via Skype is Dr. ADEYEMI, Public Health Specialist, PRO, Nigeria Health Association of Public Health Physicians of Nigeria. It's nice to have you join me right now. Now, the cases of coronavirus in Nigeria has been rising, and we've been seeing upsurge in numbers every single day. Now, talk to us, what more can people do differently? Because it seemed like the idea and the message of people washing their hands have been going out, but I wonder how much of that people are imbibing.
Okay, so currently now, because the cases have actually risen, they are rising, we've gone beyond the stage of having just imported cases to actually having community transmission now. We're actually having other people who have not traveled out of the country coming down with this. And we don't know, we're tracing them, their contact tracing is going on, but we don't know where they are. So that's why the main message right now is for everyone to take responsibility. You need to take responsibility of your own situation and also to help the nation as a whole. So please stay indoors. Right now, we're trying to break the cycle of transmission. That's a transmission from one person to the other, to reduce it so that we can actually flatten this curve and our cases would not have a sharp rise. So we're advocating that people should please stay at home. The government has come up with regulations. Health authorities have come up with regulations. Please, let's comply with this regulation. And good enough, head of various associations like the NURTW, the Market Association, they have also spoken to their members, and we hope that from today we'll be able to see compliance, because by the time people stay indoors, we're now able to break the cycle of transmission. It has gone beyond what we were advocating for before. Now we're trying to prevent person-to-person transmission, and it's transmitting at a geometric rate. It doesn't transmit in an arithmetic rate. It's not, the cases do not increase by one, they increase by multiples. But if we limit social gatherings, if we limit people coming together, congregating anywhere for any reason, then we can break the cycle of transmission.
All right, now there has been call for the total shutdown of the country, and Lagos is leading in that aspect of things, where places like markets will be partially closed and people will be restricted here and there. Is that the best way to go right now? And what would you also advise? Because River State now and Edo State now have cases, even with Bauchi State.
Realistically speaking, a total shutdown will be a bit difficult because of the peculiarities of our nation, Nigeria. Our problems in Nigeria are multifaceted, they are multidimensional. Before COVID, we're already dealing with Lassa, we're dealing with high maternal mortality rate, we're dealing with so many issues. We'll still have pregnant women in labor that still need to access hospital facilities. We'll still have people that depend, that need day-to-day earnings for them to be able to survive. And because we do not have a good social support system here in Nigeria, it might be a bit difficult for the lower economic class people to actually social isolate or to actually self-isolate and stay at home. Although drastic measures, we've seen countries where they did a total shutdown and they had a sharp decline in the number of cases. Nigeria is a bit peculiar. We need to come up with palliative measures such that if we get to the point where we have to call a national lockdown, people at maybe the local government level, there are ways in which you'll be able to help their own community members. For example, if transport system is shut down totally, in communities we could have people that will take it upon themselves that if there's any emergency case that needs to get to the hospital, they know who to call. They know who to call to help them access the healthcare facility. So if we could have some of these basic palliative measures based on our peculiarities, using appropriate technology, then I'm sure we should be able to call for that shutdown. Because in reality, if we do not have a total shutdown, we would keep having cases, because these contacts we're tracing are still meeting with people, and the cases will keep skyrocketing.
All right, now the issue of markets, we've seen how open, how unorganized, and how, you know, the average market in Nigeria, we've seen how they have always been. I wonder how that is going to compound. All right, we seem to lose the signal there from Dr. ADEYEMI. Okay. Okay. We'll have her certainly when we come back on. We're speaking with Dr. ADEYEMI. She was talking to us about the issue, the need to shut down in parts of the country and for people to stay at home, which is one of the most important ways of keeping the virus from spreading. We have Dr. ADEYEMI back now. She's a public health specialist and also the PRO of the Nigeria Health Association of Public Health Physicians of Nigeria. Now, Dr. ADEYEMI, it's good to have you join me back on now. I was asking you earlier before the signal went off that how the markets, the way our markets are, the open markets are so unorganized, so unstructured, how much of a risk does that pose to people right now with the way people go in and out of markets?
It actually poses a very huge risk. But to the best of my knowledge, based on this new regulations by the state government, it's been said that there are some schools that would actually be turned into like market areas such that it's close and accessible to the community members, so they don't have to go far or travel far before they can go to the market. So I believe in this restructuring, in trying to put markets in schools. It's still our congested markets that will be spaced out into this school fields, and I'm sure that they're going to ensure that there's social distancing. And because the market leaders have been carried along, yesterday I saw a video where an Iyaloja was teaching her market women proper hand washing. So I'm sure they're going to put measures in place in which, as you are entering into the vicinity of the market, probably you wash your hands properly before you can go in, and there'll probably be a limit of the number of people that can be in the market space at every point in time. All this is where learning and unlearning behavior. So I'm sure that as time goes on, we'll be seeing changes in even the market structure. For now, to the best of my knowledge, the only one I can say is the markets are going to be decongested because there are going to be so many schools that will be used as marketplaces. So our already congested markets will be actually spaced out in compliance with social distancing and trying to maintain feet away from each other between the customers and between the traders.
All right, now talk to us from the window of experience. When Ebola came, Nigeria was commended at handling Ebola even without any assistance from any part of the world. How much of that experience are we putting into what we are handling now when it comes to COVID-19?
Okay, because COVID-19 is a bit peculiar. It's a new virus. It's something that scientists, researchers, virologists, infectious disease specialists, epidemiologists all over the world are unraveling little by little. So we're just getting to study its epidemiology. With Ebola, the epidemiology was already clear and was certain. So we could come up with definite preventive measures. First of all, we detected the first case on time and we're able to prevent it spreading into the community. But for COVID-19, it's a little bit more peculiar. It's highly infectious. It's the pathogenicity is high as well, meaning it can spread from one person to another very fast, and we have a very, very fast rise in community transmission. So it's a bit peculiar. It's a bit different from Ebola. With Ebola, and it's the same. And one thing about the Ebola time was it enabled us, it was like a test run. So we're able to set up the Nigerian Center for Disease Control at that time, and subsequently after, they've been preparing for infectious diseases. So Ebola was like a leverage for us. It gave us the power to be able to come up with some of the strategies that are being implemented now. But then I must say that the two infectious diseases are different and their causes are totally different. This is a new one. This is one that each day we're learning more about this virus day by day.
All right, Dr. Oluwatoyin ADEYEMI, thank you so much for talking to us on TVC Breakfast. Right. All right, joining me now is Dr. Oluwatoyin ADEYEMI. She's a public health specialist and the public relations officer of the Association of Public Health Physicians of Nigeria. Dr. ADEYEMI, it's good to have you. All right, okay, fine. She's joining me straight this way. Now, let's talk about the health system that we have now. WHO has warned African countries, Nigeria inclusive, that we should brace ourselves because it could be more challenging because of the weak health system that we have in many of the African countries. Now, what do you see as the biggest challenge here if we narrow down to what we have in our system?
Okay, the biggest challenge right now, because we're having an upsurge in the number of cases, so we're having so many cases right now. At a point in time, the current isolation facilities we have in Lagos and even the few that we have around the countries might actually not be enough. So good enough, private sector has come in and they are collaborating with government to set up isolation units in stadiums and converting some event centers to isolation units. However, the manpower to run those isolation units would actually be a problem problem because there's already a shortage of healthcare workers in Nigeria and in Lagos in particular. So manpower, and even this manpower, they're on ground, but you actually need specialists because the COVID-19 actually causes respiratory-like symptoms, and most complicated cases would actually need the use of a ventilator. We have intensive care specialists who have been trained. Apart from the doctors, we have intensive care nurses who have been trained to manage a patient that is on ventilator. So we would need capacity building. The personnel are not there, but even if we even pull out personnel from the private sector, there was a time they even mentioned that they wanted to bring retired doctors and retired health workers back into practice. They are already high risk because of their age. So even if we work with those we have on ground, they would need to be trained and retrained so that they can come up to speed in the management of the patient in complicated cases of COVID-19.
All right, now the fatality rate for COVID-19 is between 3–4%, not more than that from what the reports that we're getting. But this has caused a lot of panic. The COVID-19 idea, or the virus itself, has caused a lot of panic and anxiety across the world. And watchers are saying that the fear and the anxiety and the panic is even worse than the virus itself. Talk to us about the issue of panic. The government has told everyone there's no need to panic, but how can one not panic with the way things are going? Talk to us about that.
I know we're hearing a lot of news from around the world. It's getting scarier for a lot of people. So there's a lot of panic, there's a lot of anxiety, and that is expected when you have a pandemic of this nature. How much more a pandemic that is relatively new, and even scientists are telling you that they are getting to know more about the pandemic day by day. But a bit of encouraging news, at least where the epidemic started from in China, they've been able to reduce and even bring to nil their cases in China. So if we comply with government regulations, if we work hand in hand with our health authorities, each individual has to take responsibility at this point in time. You might think that some of the measures are too stringent or they are too harsh, but then we have to suffer a bit for the better gain, and that is staying at home. It cannot be overemphasized. People need to stay at home. Those that need to self-isolate need to self-isolate. A lot of people have misconceptions about what self-isolation actually means. Self-isolation, it's been stated, it's clear. Once you're just returning into the country, you have to self-isolate for 14 days. And it doesn't mean you're in your house and you're mingling with all your family members. You're in a room and people are bringing things to you so that you do not, because at that time you're already a suspected case, so that you don't infect other members of the family. So Nigerians need to take it a bit easy, listen to news from trusted sources. It's not easy at this point in time. But then, as already mentioned, the mortality rate is actually very, very low. So if you think you are ill, you have any of the sign or symptom, just call the toll-free line and they will tell you what to do. All
right. That brings me to the issue of enlightenment and fake news. We have seen, and I feel that you too have seen a lot of videos, a lot of audio, a lot of graphics, a lot of so many posts on social media, you know, creating a panic here and there as to what one can take to cure coronavirus. Some have recommended garlic, others have recommended chloroquine, others have recommended hot water, and things like that. What do you make with piece of news making the rounds like that when it comes to the level of knowledge and awareness that people have?
It's actually inevitable. It happens anytime there's a pandemic. It's called infodemic. So there's a lot of information. After a while, it becomes too much information. So you have so much information circulating on social media, the airwaves, and even at the local community level, at the grassroots, there are so many things people are saying because everybody is anxious. They want to find like a miracle cure or something that maybe somebody might have recommended. So it's absolutely normal during this period. However, some of these things are actually dangerous. For example, the case of the chloroquine, it was actually very dangerous because a lot of people went and started overdosing of chloroquine. So if you are not sure in this period, no doubt, there's no how we can limit social media and information being passed around. But as an individual, that's why the current slogan and the current drive of the NCDC is take responsibility. As an individual, you have to to take responsibility of every news you hear and every news you share. Try to verify it as much as possible. It has been said over and over again, the verifiable sources for any information in Nigeria that you must get on COVID-19 are from your state ministries of health, the Federal Ministry of Health, and the Nigerian Center for Disease Control. And good enough, they've even set up WhatsApp, a business account, a dummy WhatsApp, where you can send questions to and you actually get responses from there. So please, we need to be wary of some of these things. Some of them in their own nature are not harmful. Healthy living, because we've been made to understand that those with good immunity are actually able to fight this virus. So things like eating well, if anybody is telling you, oh, eat your fruits, eat your vegetables, there are regular and normal things that you even have to do on a daily basis, COVID-19 or not. So some of those things you can actually continue doing them in a bid to build your immunity. But when you now start seeing some drastic measures, then I'm sure you need to pause and think that, is this actually right, and should I be forwarding this message?
All right. Thank you very much, Dr. Oluwatoni ADEYEMI. The strongest word there, take responsibility, and that is what the NCDC is saying. Take responsibility for everything you're doing for yourself, your family, friends, and colleagues. All right, moving ahead.